My name is Dr. Salim Shafeek. I'm one of the consultant hematologist, senior consultant hematologist working in West Midlands, based at Worcestershire Acute NHS Trust. And I work across in the University of Birmingham as a senior lecturer. And I used to be the clinical director till last year. And I've got various other responsibilities, including the lead for thrombosis in the trust, and also research lead for hemato-oncology. I decided to become a doctor mainly what we used to see from my very young childhood. My dad used to be a doctor, so I had sort of great appreciation of what he used to do. And living from a very young age, treating people and making them better made me very passionate to become a doctor. That's the reason I choose this profession. Yeah, I think I choose to specialize in hematology only very late in my medical career. I was trained in general medicine and finished my training, did my membership equivalent qualification, and then was looking for some specialty trainings, and I was very keen to do cardiology first, and then sort of pediatric interest as well. And then hematology also again came through my dad, who's a hematologist, so I think I just saw him working through and establishing a unit through him. I used to work with him for almost 6-7 years during the medical career, and that made it so much interested in this rare specialty. But it's definitely the right thing which I did, and I really enjoying looking after this patient group. And it is probably, hematology seems to be dealing with anything, conditions connected with the blood. And as you probably know, the blood runs in your body and it is affected by various other diseases as well. So it's like your, it can give you lots of clues to what's going on by the right interpretation of the blood test and things. So that gives us a lot of strength in coming to a lot of diagnosis, which I work with our GP colleagues, and I'm so pleased that I run a massive advice and guidance portal for a whole of Worcestershire for the last 2 years, and it has been very useful for them to make the decisions in treating. So it is really it's useful subspecialty for various diseases, not just cancer alone, but various other conditions as well. So my early years was in India. So I've qualified from Indian Medical School in south of India. And after the post-graduation in medicine, I came over here in 1994. And I did the hematology specialist training in West Midlands, then took up the current job in 2002. So I've been consultant since then. The most rewarding thing about my job is making people feel better. I mean, we get variety of conditions, so it's malignant, non-malignant. So giving that time and effort to make them feel reassured, and every day, this is our job. And also we treat many people, we can cure lots and lots of conditions, and we can keep treating lots of cancerous conditions related to the blood. So it's a very, very rewarding thing to see people survive cancer and other associated diseases. And also through the COVID period, we've been involved with a lot of blood clotting issues associated with COVID. So that's also a new chapter into hematology. And we've seen many people come through this infection. And I think I'm so privileged to see we've sorted out a lot of complex presentations directly connected with COVID and the post-COVID syndromes, and also challenges to take patients through a cancer journey. It is really a great thing from the patient perspective. So it is such a rewarding thing, and I was so pleased that I was chosen for the best doctor award for the patient choice in our trust by one of my cancer survivor, teenage cancer survivor patient. So I'm so much thrilled of that sort of passion, and also their Thanksgiving sort of thing. And also just been nominated for the torch bearer for the Commonwealth Games in Birmingham. So that's again from my another cancer patient who's doing well. They're both cured. So that sort of things you will never get with any other specialty.